Hello, I am Dr. Gurpreet Batra, consultant gynecologist and fertility specialist at Cloudnine Fertility, Ludhiana.
Azoospermia is the absence of sperms in the semen. When a male has an ejaculation, we get a liquid. That liquid is called seminal fluid or semen. When the semen is analyzed under a microscope, the cells which actually fertilize to form a baby, those cells are called sperms. So when a semen is analyzed and we find that sperms are not found in the seminal fluid, that is termed as azoospermia. In a normal semen sample, the volume of semen required for a good reproductive life is around between the range of 1 ml to 3 ml, and this should have a semen count of at least 16 million per ml or a total of at least 40 million. So the absence of sperms in the seminal fluid is azoospermia. Various causes of azoospermia can be genetic, like Klein syndrome, or some absence of genes in the Y chromosome which deter the production of sperms in the testes, or a hormonal disturbance which is called hypogonadism, where the testicular hormones are not in proper place and the testis is not producing the sperms. The other causes can be where the testis is producing sperms but they are not coming out, like absence of vas deferens or a blocket of the vas deferens, which can happen due to certain childhood infections like measles, mumps and rubella, or even certain adulthood infections like tuberculosis. Also, certain reasons like drug intake, chronic smoking can also affect the production of sperms in the testes. Azoospermia contributes to around 1/3 of the causes of male infertility all over the world. Don't be disheartened, it is not untreatable. The cause of azoospermia can be found out by doing a testicular ultrasound, by doing a hormonal assay of the patient, by doing a testicular biopsy. If the testicular ducts are blocked, the biopsy may actually reveal that the testis is producing sperms, and these sperms can be retrieved by a process called tesus, and these sperms can be used for IVF technique to make your wife pregnant. So azoospermia is easy to diagnose and easy to treat, and the last option left for a male with azoospermia is using sperms from a donor bank.